Bogart saying
Yeah,
it's always so nice.
Yeah.
She said, so the main thing what we want to do today
Yeah.
is get all the tests done. And then we'll do all the referrals that you need.
Why?
And that leg, the problem is the idea that it needs to, the problem is every time you wear those stockings, the compression socks you get, it gets worse where it stops.
Yeah.
You know what I mean?
You see the mark here too?
From what, the shirt?
Yeah.
That's not good. Those shoes are not so good.
No, because when you open it so much as I do, the Velcro is exposed inside.
Yeah, and then it starts
You understand?
it's rough. You start feeling the Velcro.
This Velcro scratches the skin.
Maybe put Band-Aids on your toes.
Yeah, I can put some Band-Aid. That's a good idea how to deal with it.
Yeah, put Band-Aids on your toes.
Remind me at home to put some Band-Aid.
We have a lot of Band-Aids.
Yeah.
Put Band-Aids on your toes.
Yeah.
Some padding to it. But you really need to do it. And basically, those the weight medicine and things like that, have you lose 35 pounds, which really what you need, for all this.
I'm not going to take anything.
Right. Stop with the juices, at least cut down.
Yeah.
Cut down and drink water.
Okay.
Let me ask in the front. Should I ask in the front? Oh, you have water in your bag?
No, this is juice. You want some?
Yeah, water. You shouldn't be carrying around.
Water, so you can ask for water.
Let me see.
Leave your bag here.
Yeah. Let me see if I can get some water.
And take your time.
Yes, he's going. Thank you. He's going to get me. I asked for 2.
Good, thank you.
So we really need to cut down. Oh, I want to.
Relax, yeah. You're so strung up. Take a deep breath.
Yeah.
Praise the Lord that you are here. Everything is okay.
Thank you so much.
Wow, what a service. Thank you.
You're welcome.
They do a nice job, you must give them that.
They've been good throughout the years now with this facility.
It's really hard to...
Hi,
Hi, how are you?
I was wondering if it was related to you.
And now
Yeah.
you know. Hi.
This is Dr.
Sarah.
Redondo.
Hi, nice to meet you.
We work together. He's joining our practice.
Oh, you are? He's going to take over your
No.
spot?
She just showed me the ropes.
No, but congratulations anyway.
Thank you.
Thank you.
Is it okay if he
Yes.
sits in
Sure,
with us?
please.
Yeah.
Yes,
Yes. Okay.
Yeah, it's funny.
sure.
And just to give you an update, they did that EUS.
Oh, okay. So what was the time?
They supposedly I'm going to see Sussman
Yes.
to
to discuss.
discuss, but it turned out it was good news. The way that the cyst was very thin.
You had multiple cysts in the pancreas, a hiatal hernia, and they did a biopsy.
Right, and they did a biopsy just to see if I had some bacteria in my stomach. They didn't do a biopsy. They never took it from the cyst itself. They said it was too thin.
Oh, you have an appointment in a week.
Yes, he's great, and it's telehealth, and it's at the end of the day, so he really
Give you your time.
Yes, we ended up last time an hour.
Which doctor is this?
Sussman.
Oh, Sussman.
Yeah. So
Okay.
but
So that's good news.
that's good news.
Let's see. We'll see what he says.
Yeah, we'll see. But it looks like monitor.
Benign.
Yeah, and it looks like it's monitoring. That's what it looks like. It'll be.
Good.
He
I
told-
did see the EUS, but you reminded me.
What?
I did see the results. I
Okay.
remember.
Okay. Good.
But
good.
now you reminded me. Good.
Okay,
Okay. So
okay.
I'll stay tuned for his note.
Okay, and I'll let you know. I see you. But my husband hasn't been seeing anyone, so I convinced him And I said, you're great, so.
Nice to meet you.
Nice to meet you.
Looks like you saw Dr. Para a long time ago.
Yeah,
Was she your
right.
primary too?
Yeah, right.
She was fantastic.
Yeah.
She was
we
very
miss
good.
her.
Oh, we missed her too, yeah.
Okay, she's doing well at the
Yeah,
VA.
yeah, hopefully. She was a little apprehensive, but she seemed to be.
Looks
Hopefully
like you're
not too.
pregnant, so you'll be out for
Yes.
when?
We're meeting and I'm
How soon will you be out?
December to March.
Oh, December to March. So it's sometime at least this year you'll be here.
I'll be here until December 5th.
Okay.
And then while I'm gone, someone will be covering.
Okay.
So it's good that you got new staff, you know.
Yes, yeah, he's gonna have to help with both myself and my colleague were both pregnant.
Wow.
Yeah, it seems like it's going around.
And the load is high. I always see people in the waiting
You
room.
guys, they really.
A whole
rush it.
bunch of people here.
we
So
are.
you're working around the clock on this.
We are. We're quite busy, but
Okay.
it's a pleasure to meet you.
Nice to meet
I
you.
saw you were just recently hospitalized at
Yeah,
Baptist.
yeah, I had some virus that really rocked me. I apparently contracted this virus.
And it was a bacterial, if you saw.
I saw.
And I asked them to transfer to you.
I
We
got
got
the
You
it
got it?
Oh, you got the record?
For looking at
because
Okay.
we have the printout, but it's only for the patient.
I got the
Oh,
results.
perfect.
So
So how long were you in the hospital?
one night, but they gave me all the battery of tests and
The CT scan and everything.
yeah, and everything. And the thing that was really the single most important was the stool test.
Yeah.
And I couldn't defecate and this doctor wanted to go home. It was the end of her shift, so she failed she also did a terrible job in infusing me. You know, sometimes when you just hang the bag of infusion without a
The
motor, the saline, it doesn't go through. And she was too stupid to see that you have to,
No.
there is a little box that accelerates the flow of liquid, and she was so busy preparing to go home half an hour before the end of the shift that she forgot about it.
The only thing I didn't see in the report when we were reviewing it was, did they send you home on antibiotic amoxicillin?
They ended up the next day after they got the
Okay.
results of it.
That's why it wasn't in there.
It wasn't
Yeah,
in there.
because
And,
what happened
it was
is
like
she
a
closed-
5-pack or it was 3
Of
days.
amoxicillin.
She was also stupid enough to close the case before a shift and went home.
Sounds like you didn't have a good experience.
No, and the nurse was really competent, and she said the doctor didn't tell her to put in the engine, and the liquid didn't go through. So after she already closed the case, she went and she brought this engine, and the infusion came through,
The saline.
and then I could
He was dehydrated.
generate some stool, and then they took the stool already. It was the shift of the next doctor, which didn't. She closed the case, and there was no open
so then
case.
They found out there was an infection.
So only in
What
the
happened
Tell you what it was?
Yeah.
Only in
It's
the
one that
morning.
they send to the health department. What is it called?
Salmonella?
Not salmon. It's similar. Bacterial, something like that, with a B. It was one which you can get it from almost like food poisoning kind of thing.
It's very contagious too, so I was concerned about her, but she
Yeah.
didn't get anything, so that
But
So
anyway.
you're
was
doing well. Okay.
Okay.
seems like that. I
So-
don't know.
Is it okay if I ask you some questions?
Sure, please ask me any questions.
The first thing that would be helpful for me to know is, are you taking any medication right now?
I'm normally trying to take vitamins and also aspirin. I got a problem, as you see, compare my legs. You see the right leg? What do you see as a difference?
Yeah, I mean, quite significant size difference.
That's right. So I have a problem with this edema, and when you press it, you can see that you see even the marks of my shoes.
I read that you had, from Dr. Carr's note, that you have a history of vascular
Yes, right.
Insufficiency.
Vascular insufficiency, and
spots from a long time ago.
it got worse when I was
DVT, yeah.
when they were giving me those stockings.
The problem is with the stocking.
And the stocking, what
All the
happens with
compression
them?
socks.
They start sliding and bunching over here, and making a bad case worse. So it busts some of the veins in the lower. It wasn't so swollen before here. You see when I press it like that, it
Are you
does.
kidding?
Are you still seeing like a vascular surgeon for the vascular?
No, because I saw him already and he told me your case is not bad enough to surge, you should just get all kinds of.
The question is, they always say, he said, I can't help you surgically. They did Doppler. I can't help you surgically, but go to Amazon and get these compression socks. And the problem is, ever since maybe for 50 years, anytime Avi was taking any compression sock, wherever it stopped, he would get the blood
Great
clots.
problem. So.
And then it was a time, because it's so hot, he would get compression socks, sometimes with zippers.
So I was thinking that the zippers are great because you can adjust the opening and the pressure like that. But what happens is it created problems. It started sliding down to here, and it cut the flow.
And then sometimes he would get like open-toed, and he would get problems.
See, this toe is red right there?
Yeah, I can see.
Because I wear these special, what is it called, diabetes shoes. Because my right foot cannot fit into a normal shoe, and I have to open the Velcro all the way, so much so that some of the Velcro at the top, which normal people don't get exposed to, scrape my skin. I have to put something on this toe there, so.
Do you think it's worth going back to them since you haven't seen them in over 5 years?
Put it in.
Yeah, I doubt it, because I hate also to be searched and to be treated.
Yes,
So because I'm concerned always.
I think at least you can do a Doppler.
Yeah, I'm concerned always that they will make it only worse.
Yeah. Order at least.
So you asked me what I want. I'm trying to take an aspirin every day, baby aspirin.
Yeah.
Yes, for
Are you
prevention,
taking
right?
any other prescription medication?
No.
None. Okay. Any allergies to medications?
No. But I'm getting tired all the time. I think that my iron level must be low.
I saw you have a history, so
The history of iron level.
we can check your iron levels
Yeah.
or ferritin to see.
Right.
And
And
then I
also
had this prostate situation when it was excessively large. And I had this doctor, what's his name?
Dr. Kava and
No.
Davi?
Yeah, and Batya.
Batya surged me with this
You
procedure.
had that prostate artery embolization.
Yes.
And then he was wonderful. And
Yeah.
it shrunk it in half.
So we should have you go back then to the urologist if you
Yes.
haven't been seen in a
Yeah.
long
I
time.
should take a PSA test and see even what it
So
is.
generally, we don't recommend actually checking PSAs actually after age 70.
Really?
Yes,
Really?
those
Why?
are the guidelines because they haven't found, based off of studies and evidence-based research, that there's actually beneficial in terms of long-term survival.
Sometimes it gives a wrong reading or something and
You
confuses.
can get a false reading if you're
And what would it hurt if he
dehydrated.
did it?
I would like to take it even though I discard it accordingly,
Yeah,
but
there's nothing that it would hurt,
Yeah,
but I guess the thought process is this.
okay.
We think about how long someone's lifespan
Yeah,
is, and
right.
if we were to diagnose you now suddenly with prostate cancer, do we think you have 10 years to survive and that the next 10 years would be quality,
Yeah, I
quality of
understand.
life would be
Yeah.
worthwhile?
I think what was my concern, if you read the doctor's hospital CT,
Yeah,
they said that they saw in his prostate
it is enlarged already.
That's
but your
enlarged.
prostate's probably been enlarged. Your prostate has been enlarged for years.
Yeah,
Yeah,
it
but
shrunk
this
it almost
this
50%.
procedure
Okay, I see what you're saying.
Yeah.
we shrunk it a lot.
It shrunk.
I can order it.
Yeah.
I don't recommend doing
Yeah,
it,
but put it
but
in.
we'll order it, and then going forward, you discuss with the urologist.
Urologist, right, and he needs to make an appointment. You know who we saw last time? He was really good. He was here.
Davi. That's
No,
what we saw,
Santos.
Oh, okay.
Santos. 'Cause he saw a lot of them because he had a lot of that urology.
I saw all of them.
He saw all of them because whoever had it, he was always getting infections and things like
And
that.
some of them were really bad, but some of them were very good.
Good.
It's really
It's so difficult.
amazing. The variance is so huge here. It was kind of struck me as
You would think
amazing.
it would be new. But I think it's the Santos, but I guess we can.
Santos, I think,
Yeah.
yeah.
Okay. Okay.
Yeah,
I
he
really
needs to see
liked.
up.
I really liked him.
He was excellent. And then I don't know if based on that, maybe based on his thing, whether Dr. Bhatia said he gave Avi extra.
Large those isotopes
those
that they
beads.
inject into
You know
you,
about the PAE?
and you can
Yes.
inject different sizes. So he injected extra large ones, telling me that it is
You
going
want to give him another couple of
extend-
years.
extend the period of the slow growth of the prostate. And I was amazed that in doctor's hospital they already wrote told me in the report that it's already oversized.
Yeah.
Okay. And then I also read that you have a history of sleep apnea.
Yeah, I
Yeah, you did a sleep
wake
study.
up a couple of times a night. I have to urinate, so it wakes me up.
So
Are you,
maybe.
are you using a CPAP?
No, I had it after that. I got so sick and tired of it, I couldn't take it
Do you
anymore.
want to get a new CPAP?
No, I saw that commercial that you have this thing that you inject, this chip, and then you have another piece that you put on top of it, and it is, I don't know the medical terminologies.
I haven't heard of something.
I haven't.
like that.
It's
Like a
called-
stimulator?
No, it's instead of a CPAP, it's called Inspire.
Inspire,
Oh, yes, I
right?
have heard of that, but I
Yeah.
didn't know that's how it functioned.
And then-
Okay.
Yeah, so they
basically functions-
insert in you a little chip, and then it has a little
I think in your
socket.
chest they put it.
No, somewhere, and then you wear on your arm something that triggers the
Inspire.
sleep.
I think it's only
It's
for
an
central
implant.
sleep apnea.
Central, isn't it?
What kind of
Inspire.
sleep apnea?
For
Central.
central coming from the brain
Oh,
as
you think it's
opposed to
really?
as
Yeah.
opposed to sleep apnea that's coming from.
Oh, this
Neck or
I didn't
pressure,
I
realize.
don't know. Really?
This I didn't realize.
It looks
Okay.
like this. It looks
Yeah.
like it's attached
Attached
to
to your
the
chest.
wall.
Yeah, that's,
Yeah.
it's attached to
It
your
triggers
chest.
contraction of the tongue.
Interesting.
Yeah,
So it's insert.
But I was really intrigued by it.
yeah, but and they make
Yeah.
it. They have a commercial, and it's really funny because they have these guys like in a group therapy, and they're all because what do you mean I won't have that? I won't have that.
Do
all
you,
this stuff.
do you want to talk
You
about
wanna-
it
you wanna
with a
talk?
sleep medicine physician?
You want to talk to him or no? You
Yeah.
have patience for that?
No, the thing is, what is true is when I went to they did the test on me,
He
and
went to downtown for a sleep test. Yeah.
I slept that night. I slept very well. So apparently, all these electrodes that they place on you,
With a nice room.
I was surprised that I didn't wake up even to urinate, which is very unusual for me.
Yeah, it's up to you.
Yeah.
We can talk about it in the future. It
Yeah.
sounds like we're already wanting to get you in to see
Yeah.
urology and
Yeah,
vascular
urology
surgery.
and also just do blood tests. Did you look? Because I
Yeah.
don't even know. They took some blood tests, didn't they?
They
in,
did.
In
They
Baptist.
did.
Maybe I should do another sleep test. I was also working many
Yeah.
years as a night security guard, so I was used to waking. I was cheating, so I should have been awake all the time. But I went to sleep. Since I wake up every 2-3 hours, I had to go around the perimeters that I was guarding and punch some clock. So it came natural to me since I don't sleep the whole night through. Every 2-3 hours,
You wake up and do that.
yeah, but I had an
portion.
alarm clock also. But for years, I got used to waking up at night and do my security duties.
Sure, so we'll have you, I'll put the
Okay.
sleep referral in.
Okay, put a sleep referral.
But I'm gonna order all the basic
Yeah,
blood
yeah,
work,
right.
you know, because they didn't do everything.
Yeah, no, for
So
sure.
we're gonna,
And also, especially the iron and anything related to that.
I
'Cause he
ordered
used
that.
Yeah, because he saw a really good. He left. I think he retired. A really good hematologist.
Dr.
Yeah.
Antunes, I think he left.
I know.
It
know.
was old, I think, or something. Or he
Yeah,
left,
and he
yeah.
did around.
He's
I think that
somewhere else.
Yeah,
there was an
somewhere else.
article somewhere
Yeah,
that
yeah.
he
He
left.
then. He was very good, and he was at the point.
Yes, he
that-
was.
He was at that point where he really didn't want to give up. Obviously, somebody had given him, I don't know, it was Parr or someone else, I think before Parr, had given him iron pills. And he said that was the worst thing for
Yeah,
him.
that was really
He should have
bad.
even gotten an iron
Infusion.
infusion rather than those pills because those pills ended up giving him constipation.
Yes, they can.
And he said that was the worst thing for
And
him.
she told me that I will get constipation, but she didn't
It
tell
was
me that
before
it
Parr,
will take 2 months or 3 months. So by the time a month or two expired, I forgot all about it. Then I was hit with this constipation.
Yeah,
And I-
we'll
Yeah.
recheck and see kind
Yeah,
of where
and
your
so far
levels
his
are.
back is okay. He had a lot of back
I
problems.
read
So-
about that as well.
Yeah.
Yeah, I had the back problems
And it also was affected with, they didn't know it was so much affected with his prostate that enlarged so much that at that time it became an emergency because he couldn't even urinate. So we ended up. It
I
was
couldn't
like-
urinate in my spine.
Retention.
Yeah.
I couldn't urinate at all. One day I couldn't urinate at all, so I had to go to emergency room.
And then Kava got
And this
involved, you know, because
Girls or ladies, nurses, didn't know how to operate. They didn't know how to operate the equipment that they put a shunt up the penis. So what is it called in English?
Foley, you mean?
No,
Yeah,
a what?
catheter.
Catheter, yeah. They didn't know how to put the catheter. So they were, all 3 or 4 of them were experimenting on me.
Oh goodness, that's
And they
not
put
a
it
good
in and out a few
experiment.
times and it didn't work. Finally,
And finally, Kava said, just tell him you're leaving and come to me.
and then finally
Yes.
when they got it connected, it was like a comedy of errors.
Oh gosh.
All of a sudden, all my urine came out and the bag was too small, so they
Oh
had
my
to
God.
replace the bag and they didn't know how to do
So
it.
you want to check him out?
Okay,
I'm
let's
sure.
switch.
Let's switch.
I had
Here
to
you
share
have the
a
story.
share from.
Let me take yours.
Yes, you're a storyteller.
Yeah.
So
Avi,
anyway,
let's go with all the stories.
No, my husband's name is Avi.
Really?
yeah, Israeli or
No, he's Indian.
Indian
It's
is
the
also
same.
interesting. I
Yeah,
didn't know
kinda-
that.
Here, you want, let me
Yeah.
take off this.
Okay. Let me take off.
All your inventions. Yeah.
Do you work here also? Or you-
Yes,
What do you do?
I teach and do research
Inventions all the time.
and inventions.
By the
Yes.
way, I sent the paperwork.
Yeah, and of course they didn't respond yet. You know what I mean? I do it about 3 times, and then the only good thing is they've already set me up. They've already set me up for
Okay.
online teaching, so they couldn't. But I appreciate it.
No problem.
Because
Wanna
you're
make
the
sure you
best.
got it.
Yeah, I did.
And I have also a disability parking.
Yeah, but that
So I need to get a letter once every year or 2
Yeah.
years.
There's
but
a
that'd be-
paper, there's a
yeah,
form that
right,
you fill out, that's
yeah.
not a problem.
Yeah,
Right.
but I have to have a doctor sign.
Yeah.
The front desk gives you it and I sign it,
Okay,
no
fair.
problem.
Fair.
Not a problem.
How do you want me to give me your bag?
But I just got it, so I
Yeah.
don't need to worry about it. All this stuff. But my real concern is that I'll get blood clots that will
Yeah, let's
break
do the,
out from the lower limbs, which I'm getting all the time. Some, I know that thrombophlebitis migraine.
He got it basically after an injury in
I
the
don't know
surgery.
what my concern is that it will go up to the heart and lungs, will break down, and
yeah,
I'll
of
be in real
course.
trouble.
And it's never been so bad, this
Well, we're
swelling.
gonna do an ultrasound and we're
Right.
gonna have you
Never
see the vascular
Your
Never
surgeon,
got
and
yeah,
not to worry.
The
yeah.
thing that caused it was those elastic.
It made it
Compression
worse.
stockings.
Yeah.
Yeah, so we gotta find a different
Different
solution.
Yeah.
Sit forward, now take some deep breaths for me and out.